warm welcome to all of you to the 6th edition of the CSR Health Impact Summit, an initiative of the Integrated Health and Wellbeing Council, the IHW Council.
I think India has always been seeing so many pandemics and epidemics and so on and so forth. Just to give some numbers, maybe, and all of you are very well aware of it. Just the bad air killed almost 27 lakh people in the year 2020 in India. 27 lakh people were killed just by the bad air. If we see COVID-19, the overall numbers, the official figure says that 5,23,000 people died because of COVID in India. But the air alone killed 27. Nearly 7.5 lakh children die before they complete or their parents celebrate their 5th birthday. This is happening in our country almost every year. And we are obviously making a lot of progress. We have reduced these numbers substantially, but 7,50,000 is too much and too many. So, and that too every year. Almost 30,000 women die during the childbirth in our country almost every year. 30,000 every year. So India has, I think, been seeing a lot of these health challenges and challenges to the lives. For that matter, TB, our country is gearing up to, our Prime Minister declared to achieve the objective of TB-free India by 2025, which is killing almost 4 lakh people in our country every year. But I believe in a country of our size, definitely government alone may not be able to make all the difference. And we have seen that during the COVID-19 time. None of us, or many of us, and many will be, their work will be celebrated to, this evening. They did not sit back and thought that the government will come and rescue.
No nation or no city, no block, no village will remain healthy, or you can look for the future of that particular area and people to say that this is the most healthy part of our country, unless women and children are healthy there. The biggest challenge is that when you say health for all, it is not health for all. It is not health for women, and it is not health for children. What am I saying? I am saying that every health indicator or every health report which considers health indicator, India comes at the bottom 10, bottom 20. Why? Because India has a very high maternal mortality rate. There is a high level of anemia among the women. The infant mortality rate has shifted by 0.6% by the National Family Health Survey Report 5, which has just been recently released. These are official data. So, and also that you have to see that this pandemic really shook us up, and our realization that if our women are not healthy, families have really got devastated, because who will look after the sick elderly parents, husband, children, if she herself is not strong enough and she herself falls sick, and many became very, very unhealthy.
The CSR, as you said, why it is not a charity, it is a win-win situation. You see, charity is something from your own pocket. You give the money and do this. If the government wants the money from the corporate sector, they can raise the tax by 2%. They will get the same money. It is the willingness of the people. They should understand. They should be sensitized. They should do something. They should innovate. One more thing, I should not miss this opportunity to tell you that we had another idea, that it may not be in cash only. It may be in kind. For example, as you all know, that the government spends a lot of money in rural development. There are lots, plenty of money. the crores of rupees are going to the villages and others. But there are no good engineers to make any plan, to have even a culvert, properly culvert made, or a bridge, small bridge made. But there are companies where they have many engineers. They can go there in Saturday, Sunday. They have plenty of time. So in the neighboring area, these engineers can go and they can help them. And that is how it will be a win-win situation. The government money will be properly utilized, and the company will also get the benefit that company is helping them. So many companies have the doctors also. Many companies have their own hospitals. Their doctors free times and sometimes voluntarily, they can go around the villages and help them. This is also a CSR. It is not the money.
Actually, it is not the 2% CSR which is important. It is how the 98% of the profits are made. If the 98% of the profits are made by unsustainable methods, by unethical methods, and by destroying the planet, and by destroying the people, then we can have no sustainability. CSR has continued to be PR-driven exercise, and it is around the factories. It is around certain people whom the company thinks they should help, but it never reaches out to the poorest districts in this country. For example, we work in all the districts in Bihar on health strengthening work. Even today, there are 115 aspirational districts. Very few corporates are in those aspirational districts, which are the poorest districts. And of course, the public sector companies, because of an order from the secretary, has started doing work in the aspirational districts. So if you go to any public sector, they will work only in aspiration districts. And this change happened only in 2019. And then COVID came. And during COVID, what happened was, a lot of the CSR went into COVID work, which is very, very good. But at the same time, what happened is, it diverted money from other sectors into COVID work. So those who were doing education, Ranjana has talked about girls dropping out, people did not have digital devices, young kids in Jharkhand did not know how to study because it was all online. So I would say several million girl children have fallen off the grid. And we will not be able to know the figures even now. We only know about the deaths which happened, we know about the COVID cases which happened.
Because when you are doing CSR and when you want to define CSR as collaborative sustainable responsibility, you would like to focus on what areas are really in need of funds, really in need of innovative schemes, innovative ideas, and where, the private sector with its expertise and its funds, 2% as was pointed out in the beginning, from the profits are taken out for CSR, can really make a dent, can make a contribution. So this kind of thing, something can be done in this area. It's an area which calls for some kind of thinking and kind of debate on how to make it possible. Then I think very nicely you have said that not only corporate social responsibility, I like this term collaborative sustainable responsibility. Sustainable is a very important word, and Mr. Cherian was right. He said, what do they do 98% of their profits? With what do they do with that? How do they make these profits? Well, if the entire manufacturing process and entire business practices are not of a sustainable nature, if they are polluting their environment around them, the air pollution, the water pollution, causing diseases, increasing diseases around them, then where is the need or the scope of CSR there, that comes in? That the whole thing becomes, empty, void, talking about it. So the whole question now comes is, if you want to have social responsibility or sustainable responsibility, this is what you must focus on. And I think what industry must realize is that profits are not the only goal. They have to be linked to the community.
If we really want to, kind of ensure the health of the nation, which is very, very important, not only for the progress, growth of individuals, but also our business houses, our corporates, and our industry. And for that, what is more important, if we can take something more concentrated, and channelize our resources, energy, if we are able to just, at least address the problem of women and child health in our country. This is going to have a lot of benefit in terms of overall improvisation of health outcomes of the nation, the health standard of the nation, and also in terms of reducing the intergenerational health burden which we are seeing.